Welcome to Occupational Therapy. Today we're going to be doing yoga with a patient. Some people think yoga is just a religion, but really some people consider it an art and some people consider it a science. It's based off a system of body postures and breathing techniques, and it's used to integrate the body, mind, and soul. A few things we're going to need before we get started. Come with me. There's a little bit of equipment I need to get. I'll be back in a second.
Some different equipment used in yoga include a yoga mat, bolsters, ropes and straps, a yoga block, and even sandbags.
Occupational therapists can use yoga as a preparatory intervention with many different conditions. Today, Paula, the champion, will be using yoga with a patient who has clinically diagnosed anxiety and with another patient who has low back pain. The OT should always begin with a thorough chart review and a patient interview to note any precautions before beginning yoga therapy. It is also good to perform a relevant assessment before and after intervention to show progress. This is Emily. She is 17 years old living with anxiety. Paula decides that the Berg Balance Assessment is appropriate for Emily because she wants to use yoga poses that challenge Emily's balance, refocus her concentration, and channel her energy. Her initial Berg Balance score is 45, shows she is safe to do the more challenging poses, but we are hoping to improve this score over the next few weeks. The first pose Paula shows Emily is the child's pose. It is important to inhale through the nose as she begins to move into position and exhale as she brings her head towards her knees. This pose is an asana, meaning posture. It allows Emily to open up her arms and release energy while moving into a fetal type position so she still feels comfortable and safe. Next, Paula chooses to demonstrate the tree pose. Tree pose increases balance, focus, memory, and concentration. It also strengthens the ankles and knees. For the first part, you bring your foot up and place it against your thigh. Make sure you have your balance before you let your foot go. Then bring your hands together. It is beneficial for Emily to redirect her focus and concentrate on things that do not cause anxiety. It's important to stay balanced, and if your patient's balance is questionable, then consider using a gait belt for safety. Lastly, Emily performs the half moon pose after demonstration. This pose produces the same benefits as tree pose, but requires greater balance and requires Emily's full presence in the moment for her to look up to her hand and maintain her position. The block allows beginners to perform more complicated poses safely, and it gives Emily the just right challenge. Again, consider using a gait belt to promote safety if your patient's balance isn't as good as Emily's. This is Michael. He is 36 years old with low back pain secondary to a CrossFit incident. Paula decides the functional reach test is appropriate for Michael because he has trouble reaching higher shelves due to limited range of motion and pain. Michael's initial score on the functional reach test is 8.5, and we're hoping to gain range of motion without pain through yoga therapy. The first pose Paula chooses for Michael is cat-cow, or some people like to call it kitty moo-moos. Cat-cow is a gentle flow between two poses that warms the body and brings flexibility to the spine. It stretches the back, torso, and neck. It brings the spine into correct alignment and can help prevent back pain when practiced regularly. The second pose Michael learns is downward dog. Downward dog energizes and rejuvenates the entire body. It deeply stretches your hamstrings, shoulders, calves, arches, hands, and spine, while building strength in your arms, shoulders, and legs. The last stretch Paula chooses for Michael is specifically a back stretch. Paula shows him how to use straps to get greater flexibility in the beginning. It's important for the OT to stay by the patient and ensure proper technique is used. Hopefully from these 2 treatment sessions, you'll see that yoga is a very beneficial intervention that OTs can use to meet their clients' needs. Remember to stay client-centered when choosing yoga poses and to follow yoga with functional and purposeful activities. After 6 weeks of yoga, Emily's bird balance score is now 52, and she reports improvements in calming her anxious thoughts at school through refocusing her attention. Let's take a look. After 6 weeks of yoga, Michael's functional reach score is now 13, and he reports significantly less back pain during functional activities. Let's take a look. Now remember, yoga is not about touching your toes. It's about what you learn on the way down. Try another one?
Yes.
We have a tree pose. Okay. First, I want you to bring your hands together. Okay, hold on. Pick up the shoe, which is in front of your feet. Okay, thank you.